哎呀，油管频道被删了，真是好伤心啊！那以后咱们就致力于分享东西和英语学习的频道吧。今天呢，我们就来分享一条推特。这个人我也是从昨天别人的这个点赞或者是转发中看到的，还挺有意思的哈。The people often claim that capitalism performed better than socialism in terms of poverty and human development in the 20th century. This story is repeated so frequently that no one ever even bothers to back it up. Is it true? Thread. This question was explored in a remarkable paper published by the American Journal of Public Health. Using World Bank data, it finds that at any level of development, socialist countries outperform capitalist countries on key social indicators. In 28 of 30 direct comparisons, socialist states had lower infant mortality, lower child death rate, longer life expectancy, better literacy, better secondary education, better food access, more doctors and nurses, and a better physical quality of life. The paper is paywalled, but you can find an open access version here. This research confirmed earlier results published by Amartya Sen. Sen found that in the global south, socialist countries tended to perform better in terms of social outcomes than capitalist countries. Building on these findings, Sen went on to spend his career arguing that democratically controlled public provision systems, entitlement guarantees, and state-led industry policy are central to good development strategy and should be prioritized. These findings were supported again by the Spanish Public Health Academy, Vincent Navarro. Contrary to dominant ideology, socialism and scientist forces have, for the most part, been better able than capitalism and the capitalist forces to improve health. The conclusion from this research are pretty simple. If you want to improve social outcomes, then focus on universal public services. And from more recent research, we know that when these services are democratically managed, they are even more effective. This approach, which gained significant traction among global South states after decolonization, was almost completely destroyed by neoliberal structural adjustment programs. If we want to be serious about evidence-based development, we need to bring it back. Wow, it's very informative and very good.